Hi, my name is Josiah, and today I'll be talking about Parkinson's disease in geriatric patients. So our website is called the Parkinson's Path. So a little bit about our purpose. Our purpose is looking at Parkinson's disease is the most common neurodegenerative disease with geriatric community, and we want to make a path smooth for our members. Some key topics we want to look at here. I notice that we believe the bigger the group, the safer the journey becomes for our members. So we want to provide each patient with this type of disease with a neurologist, primary care physician, Parkinson's disease neurospecialist, a physical therapist, an occupational therapist, a speech therapist, a social worker, a dietitian, and a caregiver. So first, let's see the risk. As you age, you become more likely diagnosed with Parkinson's. Males are more likely to present the signs and symptoms compared to females. Environmental factors can cause this, head trauma or genetics, but it's never inherited. Now we want to also look at some probable interventions that we can provide for them. Some the best techniques we can provide for our members is help them with our physical occupational therapists as they will provide gait training, activities of daily living, strength, and balance. And what else we can provide for them? Everyone can have a part by reaching out and promoting our awareness throughout all of our communities. Greater fundraisers, social events, and finding testing locations near you today can help benefit the movement. And now we want to go into our next slide, just more about it. So Parkinson's in general. So disease and etiology. Parkinson's disease is a neurodegenerative disorder primarily caused by a loss of dopamine producer neurons and sustained in the Nigerian of the brain. The exact cause is not fully understood, but it is believed to involve a combination of genetic, environmental, and age-related factors, as I spoken earlier about. Some signs and symptoms that we may see: tremors, posture change, slow or soft speech, shuffling gait, mask-like facial expressions, and cognitive impairments. So here's some of the signs things they may see: shaking hand, hunched over, and shaky footsteps. But we are here to clear the path and understanding Parkinson's for them to make their journey much easier. So now looking at the services that we can provide. So interventions, many ways we can make a change for people living with Parkinson's and allowing them to have the ability to sustain a stable lifestyle. There are three ways we can do this. Medication. So the primary medication that they're given and Parkinson's patients are given is levodopa, acts as dopamine due to the lack of dopamine that their body has. This helps them just maintain that level. An anti-cholinergic, it helps reduce the tremors and muscle rigidity. So helps reduce that hypertonic sense of their body of always tensed up high and just shaking the whole time. But I also mainly want to talk about avoiding the medication. We don't always want to use this, but I want to see this as a last resort for our care, as we don't want them to become addicted to the medication and rely too much on it. But we want to look more at the interventions, the PT and OT interventions. We can truly focus on gait training, balance and coordination, relaxation techniques, breathing exercises. And there's also a thing that's called Parkinson's Wellness Program. It's a structured approach that combines education, exercise, and self-management strategies to help individuals with Parkinson's disease live their best lives. So this is almost like a group therapy exercise that where they're all getting patient educations and how to properly live with this disease and how they can properly maneuver in the areas, and also seeing that other people as them are in that community, they can help work together and just feel more encouraged to come out and join this group. And I also just want to show a little graph I saw in a study showing that the more activity that we're moving decreases the amount of decreases our slowest movement, because with Parkinson's disease we see a lot of foot shuffling, slow movement, and the more activity we have shown, the more hours, it decreases the amount of the slower steps are less and increasing bigger steps and just a better stride overall. And I want to look at our contact information. So we're primarily located in the Will County District in Colorado, as you see on the map over here on the bottom left. Provided of all those hospitals, we are going to be stationing a little location of that can provide help with Parkinson's patients. Open Monday through Friday, 7 a.m. to 7 p.m. Saturdays through Sunday, 7 a.m. to 5 p.m. There's our contact number, and our email is parkinsonspath@gmail.com. And then below, once again, you see the image of locations that we were able to provide at the hospitals in this area that we were able to help you out. Thank you.